Welcome to the Mamatoosa podcast. I'm your host, Atusa Benji. Hi, it's so good to have you. I have been so excited about this interview because you were one of the top women I wanted to interview on my list because I feel like I have so many heavy stories, so many life happening stories, so many deeply profound stories. And your story is deeply profound and very happy. And I just wanted you on. I adore you. Hi, listeners. This is Tamara. And I met Tamara about a year ago. Was it a year? Maybe a little bit more. When she asked me to come in and interview. She was seeking a birth doula. And she was referred through someone who's near and dear to both of us. And I said, of course, any friend of yours is a friend of mine. And she just said, Tamara is lovely. And I was like, I bet. And so I met you and I came back in the car and called her. And I was like, she is lovely. Oh. And she said, she really is just a beautiful human. And you really are. And I'm just so grateful that our paths crossed. And we have this amazing story to share that is your story that I got to serendipitously be a part of. And welcome.
Thank you, Atusa. It's great to be here. It's great to chat with you today. And thanks for having me.
Thanks for your time with two little kids. I want to really capture the essence of your birth decisions, your view of birth, your view of labor, and what your first birth story was like, and then we can get into the second one. So tell me about your first baby's pregnancy, conception, and then delivery and birth.
Yeah, everything went very smoothly, very easily for me, and with my first pregnancy was great. I was very active during pregnancy. Labor was a little bit longer than I had anticipated, but it wasn't...
Not a 3-day marathon.
Exactly. I had plans to labor in the hospital after laboring as much as possible at home. I had my husband there with me. He was my support. After a few hours of laboring at home, I thought, maybe it's time to go to the hospital. So that's what we did. And I had plans to have an unmedicated birth, which is what happened, which was great. But things did not go according to plan, how I had anticipated. While I was in the hospital, there was some miscommunication between myself and the nurses at one point, where I thought that I could not get out of the bed, where I thought I had to labor in bed. And my husband really supported me throughout the process, and he was able to kind of navigate the situation to kind of alleviate the miscommunication that had occurred. Yes.
Wow. Had you taken a class or anything to prepare?
I had not. I had my mom. She was living in Memphis at the time, and she kind of told me about her own stories.
Yeah, her birth stories.
Yeah, exactly.
And how did that inspire you?
She helped me by telling me what helped her. She had a focal point, and it really helped to keep her focus during labor. And she encouraged me to find a focal point, which happened to be a piece of artwork that my mother-in-law made, and it was hanging in our living room. And so that was kind of the thing that I looked at and focused on throughout my labor.
I love that. She must have taken a Lamaze class because the focal point is very Lamaze, is very Lamaze-esque. The thing with the different types of birth classes and listeners, we're going to talk so much about different ways of birthing and different classes and different theories. But my opinion is what you learn and you believe in and you practice will work. So I've had people call which one is the best one? The one that is the best one is the one that resonates most with you. And for one person, it might be a focal point. For one person, it's get that focal point out of my face. Otherwise, I'm going to tear it up. For another person, it's hypnobirthing or hypnobabies or Bradley. There's no wrong way to prepare, but to prepare, to believe in your method, and then to practice it, I think is paramount. So it sounds like the focal point worked, and it was handed down from Mama.
Yes.
So Mama was in the room.
She was not there. So she was in Memphis. She was in.
So she didn't come down.
No.
Okay. So your partner was head coach, head doula.
Yes.
And he was on board with the unmedicated.
He was fully on board, and he really helped to support me during that process. So at one point, I felt like the nurses really like pushed me to get the epidural and to go medicated. My husband really supported me, and he met them at the door, so I wouldn't have to hear the conversations that were happening.
Wow.
And it was only later that I realized that they kept kind of pushing.
That had happened.
Exactly.
Wow, that's incredible. What was your impetus or motivation to go unmedicated?
My mom had 3 unmedicated births, and I had talked to her about her experiences and really just how empowered she felt afterwards, and how, although there were times where it wasn't comfortable, just like being able to feel everything and be in charge of her own body was really powerful for her. So really my mom's story was really a huge motivation for me. But also bringing a child into the world and without any medication was really, really important to me, and to be able to have that experience with my child.
I'm getting goosebumps, which whenever I get goosebumps, I know that the universe is like, I just get this wave of like, yes. Empowerment from your mom about birth is so beautiful, and I feel a little bit rare. Because many times our mothers or our elders or the women who came before us, our sisters, our neighbors, really equate so much trauma and pain with delivery and so much complication that having your mom be the one to be like, no, I got this, you got this. I felt everything. I was not traumatized through it. And the pain actually was beneficial. Because in our culture, pain is not really looked at as beneficial. Pain is a bad thing. So we have a lot of different pain medications. We often associate pain with pathology, which is typically accurate. When you're in pain, something's not quite right, except with labor, which is pain is absolutely normal. And all of the physical symptoms that one has with extreme pain, including shaking and sweating and vomiting, maybe crying, and you're looking at this person going, is she okay? Like, what is happening here is completely part of the normal physiological process of natural birth. And to come out of the other side, to be empowered with all 3 children, and then to pass that down, what a gift.
Yeah, it really was.
What a gift.
I would say my mother's empowerment was huge for me, but I also did a lot of research on my own to really understand the physiology of birth and the different hormones that actually help us to be able to deal with the pain that we're having.
Right. The same way that the body produces the pain, the body provides hormones that help work with the pain.
Exactly.
When the person is not bothered, which it sounds like your partner was doing a really good job of not allowing anyone to bother you.
Yes.
Had he done the reading with you? Did you do it together, or?
I did most of the reading, and then I kind of summarized for him what I had read. And through that, he was able to really understand what I wanted and what was important to me, so that he really was the best support I could ask for.
I love that. And again, to show that you don't have to take a class.
Yeah.
That was your way. You did your reading, you did your research, and then you shared it with your partner. You don't have to sit in a class with your partner to get what you need from birth. Sometimes it's ideal and sometimes it's not necessary. Sounds like you guys found your way.
Yeah, absolutely. I had a lot of fears leading up to my first birth. So that 9 months of preparing was very, very helpful for me in really gaining my own knowledge of the birth process. Really helped with my fears and to help kind of alleviate those fears.
Was there a favorite book?
There was one I remember, it was called The Orgasmic Birth.
Nice.
I would not say my birth was orgasmic either time, but it really helped me.
You and me both. Might have been nice.
Exactly. It was something to strive for.
Right. Exactly. Maybe number 3. Well, one at a time. I'm always bothering her about number 3. Very annoying. But yes, The Orgasmic Birth. Tell me what made you, what appealed to you other than the title, obviously.
The title was enticing. Absolutely. I hadn't read it in a few years at this point, but yeah.
You pulled it out.
Yes, I I pulled it out, and just some of the stories. Reading the women's stories and their experiences was really helpful, and surrounding myself with positive stories versus maybe more traumatic ones or challenging ones.
Yeah.
Really helped me to have an open mind.
That makes perfect sense.
Yeah.
So no orgasms for us, but that's okay. You enjoyed the book, which is important. And I love how your partner was just able to organically understand what you needed and also be a bouncer of sorts. Hey, nurse, greet you at the door. What do you need to do? Does she want medication? No, we're good right now. Come back in a little bit. And most nurses are very, very respectful of that, unless they actually have to come in and move around monitors or do anything. Mm-hmm. I'm glad that they were able to let you labor unmedicated. But you never left the bed.
I did eventually leave the bed.
Okay.
Because what helped me was really being in the shower. That warm water on my back really helped to relax and help my labor to progress. And so at one point my labor had stalled, and that's when I was laying in the bed. So once we had that miscommunication kind of cleared up, then I was able to get back up and go back into the shower.
What cleared up the miscommunication?
My husband.
What did he say?
He had asked the nurses if I could move because he actually asked me, why are you in bed? You told me you wanted to move around during
I love that so much.
Your labor. And I said, I do want to move around, but I was told I didn't think I can get out of bed right now.
Right. And actually that happened to me with my first baby too, where once a monitor is hooked up to you and an IV is put on you and you're put in a hospital gown, you feel kind of patient-y. And what do patients in hospitals do? They lay in bed. So the notion of changing that paradigm of I'm actually not a patient, I'm not sick. I have a PEP lock in place should we need it, and I have monitoring that can be intermittent, and I don't have to wear a gown. You don't have to wear a gown, which is so powerful because I don't like hospital gowns at all. I associate them with sick people. And so I always encourage my clients, take your own gown, wear something pretty, wear something disposable, wear something that makes you feel comfortable. So I completely get it, that culture of hospital, bed, I must be stuck here. And I believe that in many ways, it's actually more convenient for the staff when we're in the hospital and we're on the bed. Because when your patient is moving around, you have to actually keep track and be like, what's going on? Is the monitor on? Is the monitor off? Go in more often, check on them more often. So there is a little bit of convenience that is associated with your client staying in the bed, I feel like. So you got to 10 centimeters, started pushing. Your doctor was there?
Not there.
Not there.
Yes. I felt the urge to push. I think I pushed for about 10 minutes, and so the doctor wasn't able to make it. But while I was pushing, at one point, I remembered the doctor who was on site, her hands, she had to reach inside of my vagina to rotate my baby so he could come out because he got stuck in my pelvis. And after that, he came He
came easily.
Yes.
Did they explain to you what was happening at the time? So his head came out?
His head came out partially, and so his shoulder got stuck in my pelvis. At the time, I did not realize why they were doing that maneuver. Afterwards, they explained to me that he had gotten stuck in my pelvis.
So he had a shoulder dystocia.
Exactly.
Did it last a long time?
No, seconds.
Seconds.
Yeah.
So very quick moving hands from the OB, shifted the baby with her hands to rotate a little bit and make it under your pubic bone. Was there damage? Like, did you need stitches? How was the healing afterwards?
I had a minor tear to my perineum, and the healing afterwards was, I would say, pretty straightforward.
Okay.
Yeah.
Okay. Kind of unremarkable.
Yeah.
Okay, good. And so how was your postpartum period?
The healing was really easy for me, I would say.
Great.
Yeah.
So good healing, easy breastfeeding.
Yeah.
Amazing.
Had some a tricky time with breastfeeding. So
tell me more.
Yeah. So my son had a tongue tie. So the latch was difficult. So it was hard for him to get like full feedings. and it was a little bit painful. So luckily, our city is full of lactation consultants. So I was able to find a lactation consultant and kind of get the latch cleared up. And that really helped with breastfeeding afterwards.
Wonderful. We're going to have a whole interview about tongue tie and lip tie and lactation consultants and when do you snip and when do you not snip. But sometimes when the tongue tie needs to be revised can just be the open road to much easier breastfeeding and less pain and some issues that can happen later when children have extreme tongue ties. What made you not have a doula the first time?
I had thought about it, but I really felt confident that I could achieve the birth that I wanted in a hospital setting with myself and my husband.
And you did.
And I did.
And you did.
Yeah.
And you did. And so fast forward a few years, pregnant with your second baby.
Yes.
And what's going through your head?
So it took me a while to find you and to reach out. But throughout my pregnancy, I felt very confident I could do the same, have a hospital birth unmedicated. But as my pregnancy kind of progressed, my OB brought up the fact that there was a shoulder dystocia with the first, and the second one was measuring large at the time. And so I really wanted to be able to achieve an unmedicated vaginal birth, but there were some questions as to whether that would happen. At one point, I was thinking of maybe having a C-section or being induced at some point if the baby were
smaller.
Exactly. I'm also very aware of, with induction, how that can sometimes lead to a more complicated delivery, needing other medications or potentially even a C-section. So I really wanted, although my husband is very supportive and he is my rock and he would support any decision I would make, I really wanted somebody who could really help me navigate that system if I needed to have an induction or have a C-section.
Interestingly, as afraid as we are of big babies, and especially Western medicine does not like big babies at all. Some of the most difficult shoulder dystocia stories I've heard have been with very small babies, not so much with the big babies. So it's a interesting bias we have for the big babies. And I think big babies, especially ones where diabetes has been involved and the babies have these very big shoulders and a lot of fat around their chest and their armpits and stuff. And those babies could get stuck. Typically, it's been my experience that when women are unmedicated, they can navigate the position that they need to be in to deliver their baby. And if we need to move them, an unmedicated woman moves very, very quickly, which is something that a woman on epidural can't move as fast because she's numb. So can we move her and put her in different positions? Yes, but not to the speed and as well as we can someone who's completely unmedicated. And we have all sorts of maneuvers. It sounds like, were you on your back with the first one?
I was on my back. And that I would say that's another reason that I was seeking to have a doula. It was because I wanted to be able to push in any position that I wanted to be able to push in.
And you did.
And I did.
We're teasing you. So we spoke. And we had one prenatal visit, I think, out of the two that we were supposed to have. And then what happened?
Well, I think I found you at like 30 or 32 weeks. And then we had our prenatal visit. And with my first, I had gone full term, maybe one day before my due date. So I was expecting the same thing to happen.
40 weeks.
Exactly, 40 weeks. But at around 37 weeks, I woke up one morning, had some cramping, didn't really think much of it, dropped my kid off at school, or my husband dropped him off at school. And I realized, these cramps are kind of ramping up a little bit. Had a prenatal appointment with my OB, and she had told me, she had checked my cervix and said that I was probably having that baby today. So then there we are.
At 37 and like 2, right? It was just a couple days.
Yeah, just a couple days.
After 37 weeks. So backing up real quick, what at the doula interview and then at the prenatal visit set your mind at ease for moving forward with a hospital birth despite shoulder dystocia risk. And listeners and viewers, with obstetrics, anything that happened the first time, you are at higher risk of having it again. So someone who had a shoulder dystocia the first time, likely to have it again the second time. Had a hemorrhage the first time, likely to have it the second time. Had preeclampsia the first time, likely to have it the second time. So we always, when we see that on the chart, we're like, okay, so now the risk has increased just a little bit to it may happen again. It doesn't mean it's definitely going to happen again, but it's on the radar. So what sort of were you at ease after the prenatal visit? What shifted for you?
Yeah, so I was more at ease having you on my team. I also know that you're trained as a midwife as well. So I felt very confident that I had the medical professionals on my team that I wanted to have. Mm-hmm. And I was nervous about having another shoulder dystocia with my second. So after talking with my OB, she assured me that all the equipment would be in the room that we needed to be able to manage a shoulder dystocia if it happened again. But then I also felt really confident having you on my team because you also shared with me your own expertise and your own knowledge of what you've experienced with birthing and shoulder dystocia. Mm-hmm. So I felt very confident that I could have the baby vaginally, especially at 37 weeks when he started to come.
Yeah. Well, he knew. He knew
He knew
that he didn't want to get too big. He's like, my brother, he left me a note. It's like, try to come earlier. Don't get too big. So I really want to emphasize that this isn't so much about me as an individual, although this is the Mamatoosa podcast and we talk a lot about my life and my experience. But I really want the viewer to understand, how does a midwife come in when someone already has an OB that they have a beautiful relationship with and they trust, and they want to have a hospital birth? Because for a minute there, I was like, do you want to have a home birth? And you said?
I did want to have a home birth. I had some reservations about having a home birth.
And rightfully so, because shoulder dystocias can be really scary. And there are measures in the hospital that make people feel more comfortable. And so that was honored. What did you understand about how a doula who is a midwife could help you versus a doula who's a doula?
I felt really confident having you on my team because as a midwife, I know that you are also medically trained to be able to manage any sort of complication that were to happen. So I think I asked you so many questions about, if an emergency happened, how would we handle that? Mm-hmm. And so I felt really confident that I would be well taken care of no matter what happened.
In the birth world, there are doulas and there are midwives who provide doula services. So when a licensed midwife provides you with doula services, we're actually not contracted to catch the baby, so we're not doing the delivery, but we are doing supplemental prenatal visits in between the ones with your OB. So we're still keeping an eye on blood pressure, we're keeping an eye on baby's position, we're counseling about nutrition, we're talking about the birth, we're talking about stress, we're talking about life, we're talking about exercise and sleep and all of those things that are holistic, because a lot of times obstetricians just don't have that time within the system to spend an hour and a half at a prenatal visits. So we come in and sort of supplement that. And then at the delivery, because we're midwives, we are licensed to listen to heart tones, make sure baby is tolerating labor, to do a cervical exam if the client asks us to see how far along they are in labor, to take vitals, and essentially to manage the labor until the client is ready to go to the hospital. Or perhaps the client has a plan with another midwife to deliver at home, and until that midwife comes. So it's a midwife in a doula role that has more skills and also more scope, because a certified doula is actually out of scope if they do anything medical. So a certified doula can't take your temperature, can't diagnose, can't prognose, cannot check your cervix and tell you how far along you are. Do doulas do it if they have the skill and it's agreed upon? Typically, they're not certified, or they're stepping a little bit out of scope, which we'll talk about on another episode. But in a situation where you hire a midwife to be your doula, the client understands that should delivery need to happen, the midwife has a bag with her. And the midwife is essentially keeping an eye to make sure the labor is going in the right direction. And when it's not, then you go to the hospital a little bit sooner. And that was our plan. So 37 weeks and a few days, you call me. And I remember you said, I've been having lots of cramping. I just went to the doctor and were you 5 centimeters?
I think it was 2.
Were you 2? Okay.
Mm-hmm.
So I'm 2 centimeters and doctor thinks it'll happen today. And I was like, okay, great. Keep me posted. Then what happened? What was going on at your house?
Well, I had made plans with my mom to go for a walk that morning. And we kind of veered off of that plan and went home to my house. And I needed to get some things prepared for bringing to the hospital. So I was like, okay, I'll pack my hospital bag. But then I got home and I looked at the place and I was like, it's a mess. I have dishes to do. I have laundry to fold. So I'm just going to start working on doing the dishes. So I did some dishes.
Nesting.
Yes.
Nesting.
Exactly.
Yeah. Yeah.
Did some dishes. And then I realized, I hadn't eaten anything. So if I actually am going into labor, I probably should eat something. So my mom made me an egg, which I couldn't eat. Just didn't really have the appetite to eat it. And then I decided, okay, I'm just going to get in the shower for a little bit because the contractions were really kind of ramping up. It had been maybe an hour at that point. Mm-hmm. So I got in the shower. My mom was like folding laundry for me, really helping me to nest. Mm-hmm. And she was also recording all of my contractions at the time, the duration and frequency. So I was in the shower and then I get out of the shower. I'm like, okay, I'm going to get dressed. But I just didn't feel comfortable. So I didn't want to get dressed. And I thought, maybe I'll just take a bath. I'll get into the bathtub. So my mom helped me get the bath ready. And I walked over, got in. And then that's when I realized, I think we're actually in labor. Because I was definitely in denial at that point. Mm-hmm. Did not think he would be coming at 37 weeks. Thought it would be more like 40. And I
thought
wasn't
it would
ready.
go away.
Yes.
Yep.
So usually my husband's at home. He's working, but that day he happened to go out.
Of course.
And so backtracking a little bit, when I was in the shower, my mom told me I should probably call my husband and let him know to come home. So I called him and I asked him how far away he was, and he said he was 30 minutes. And then in my head, that was me asking him how far he was from home, thinking that he's coming home. Mm-hmm. I call him and I said, yeah, I might be going into labor right now. And he said, should I come home? I said, no. How far are you from home? He said 30 minutes. I said, okay, great. So I get in the shower. And then after I get out of the shower, tell my mom to start the bath. She's like, wait a second. Did you call Atusa? Did you call Omid to tell him to come home? And I said, yeah, I think he's coming home. But then I realized, oh no, I didn't tell him to come home. So I have to call him and tell him to come home. And then I called you and I said,
should I come?
Over. Yes. You asked if you would come over. And I said, yes, please come over. So
and we always say, LA traffic, give me an hour. Always give me an hour. It didn't take me an hour to get there, but always give me an hour. And in prenatal visits, if you live a little further away, give me 2 hours because it's LA and you just don't know what it's going to look like. It's never taken me longer than an hour. Thank you, God. I just put that in the universe. It will never take me more than an hour to get anywhere ever. But I always give clients that sort of give me an hour, which is probably what I said.
Yes. You said, give me an hour, but you said, I'm probably
on my way.
So I get in the bathtub and 20 minutes later, my husband gets home. He's like, is Atusa here? Is she coming? I was like, yeah, she's on her way. So he called you to see where you were. At that point, I'm getting really uncomfortable. So he called you to see if we should go to the hospital. Mm-hmm. So I'm like, maybe it's time to go.
And I was on your street already.
Yes. You're already on the street.
Yeah.
You came in, came upstairs.
Grabbed my bag.
Yes. Tried to take the baby's heart rate. And
we took the heart tones. Well, I looked at you and I was like, oh, well, hello. I think we're having a baby. And I said, unless you want a home birth, I think we should go. Right? And at that point, I could have checked you. I could have checked your cervix. But what would that have told me?
Right.
And if anything, it might have actually stressed you out even more, because if I would have told you you're 10 centimeters, then it would have been like, well, do we go? Do we not go? What should we do? So we didn't do a cervical exam. Listen to the baby. Baby sounded great. And you got out of the water. And we told Omi to get the car. Your mom was so sweet. She was helping out. And then I said, where's your robe? Like, what do you want to wear? You're like, I don't no. And I was like, oh my God, we're having a baby. As soon as the birthing person tells you they don't care about what they're going to wear or how they're going to cover up, you know that a baby is coming. So if you're on your way to the hospital and your client says, let me just brush my hair, or let me slap on some lip gloss, or let me put on my underwear and my pants and my shirt and my jacket, the baby is not going to come. Now, that is relative, right? There are people who are like extremely conservative or have religious or cultural preferences, and their scarf is on their head, or they keep stuff on, but it's subjective. So if the person is typically pretty liberal with being naked, they will walk out of the house naked to the car to go to the hospital. If the person is a little more conservative, they might grab something, or maybe their scarf will fall off their head. So it's just sort of subjective depending on where that person's baseline is with nudity. In your case, you literally couldn't answer me about where your clothes were. And so I ran to your closet. We grabbed something, and were you wearing underwear? I don't even think you were wearing underwear. I think it was just a robe.
Yeah, it was a pair of boxers.
A pair of boxers. Yes. Now I remember. It was a pair of boxers and a robe. So we grabbed a robe. Your partner was driving. You were sitting in the front, and you could not sit.
Could not sit.
So you were sort of like on your arms, right?
Mm-hmm. I was holding myself up with my arms. Correct.
Right. For obvious reasons, which the viewers, I'm assuming, are starting to kind of get the picture. And I decided to come in the car with you. So I actually grabbed my bag, and I thought, if this baby decides to come, at least I have some stuff with me, and I'll just sit in the car with you. Typically, I don't. Typically, I drive behind the client so that I have a car to come home with. But in this scenario, I was like, I just had a little feeling. But then what happened?
I remember squeezing your hand the entire ride to the hospital, which was like maybe 5 minutes.
Yeah, super, super short.
Felt like a really long time.
Yeah, sure.
And when we got there, we were in the valet, and
it's a long line.
Yes, it was long. Everybody was in the valet that day. And so you had said, Tamara, let's get out of the car, and we'll walk up to the entrance to go to labor and delivery. And then Omid, you stay in the car and deal with valet.
Right. Especially because I didn't know how to drive his car.
Right.
Also. So I don't know how to drive this car.
So he was going to the plan was that he was going to meet us in labor and
L&D.
delivery.
Yep.
Yes.
A few minutes.
Yes. Well, I felt like every step I took, I was having a contraction. I could not make it to the entrance of the hospital.
It was very, very, very close. And I remember we opened the door and I helped you out, and you had a contraction. And then there was this man who was like this little angel sort of fluttering around. Do you remember him?
I do remember him.
A lovely older gentleman. And he's like, do you need a wheelchair? I thought he was hospital staff. And I was like, yeah, let's get a wheelchair. So we got the wheelchair, but you couldn't sit.
I couldn't sit.
So it was completely futile.
I was looking around, kind of see what is around. We were in the sun. It was really, really hot. And you said, well, Tamara, if you can't sit, we're either walking to L&D or you're having this baby here. Which one's it going to be? So, well, we're going to do it here.
Yeah. And you very clearly where I was like, we've got a couple options. It's either sitting in the wheelchair or kneeling in the wheelchair. You were like, I can't sit. And then every time you walked, you literally had a contraction with every single step. And you looked super chill. You were so relaxed. There was no groaning, no screaming, just pausing when you had a wave. And that was about it. So I turned to the valet staff and I said, can you please call someone to come down? A baby's coming. And it was like I was like talking to thin air, like nobody listened, because I think you were so relaxed that it didn't look like you were having a baby. So they were like, she'll figure out. We'll see this all the time. So I said again, can a doctor or a midwife please come down? She's going to have a baby. Nothing. I said it 3 or 4 times.
Yeah.
Nothing. So the man with the wheelchair was sort of watching.
I feel like he knew what was going on.
He had the cue. He definitely was like, I'm going to hang around here. And he was holding his valet ticket, as were other people holding their valet ticket, waiting to get their car or drop off their car, because there were like 12 people in line.
Yeah.
So what was going through your head?
Well, I thought if we're having this baby here, I can't do it in the sun.
It was hot.
And yeah, it was hot. So I saw this bench and it was in the shade. And I said, Atusa, just get me to that bench. And you did. You helped me get to that bench. And so that's where I had him.
Yeah. And I actually said to you, because I opened up your robe, or your robe was kind of open. I was like, she's got boxers on. And I said, is it okay if I pull down your pants? I said, is it okay if I pull down your pants or your shorts? Or I said, is it okay if I pull down your underwear? And you were like, yes. You were so like, this is happening now and we're just going to do it. And I was like, all right. There's all these people watching. I pulled down your pants and someone goes, oh my God, she's having a baby. And I was like, no kidding. I've been asking for help for like 3-4 minutes. Like, send someone down. Nothing. So you deliver in what position?
Standing.
And I caught the baby and sort of football passed him through your legs. And your baby was pink and crying and happy. And I was like, thank you, God. Because when his head came out, I literally said to him, I was like, you are not getting stuck. Literally, like energetically, I was like, we're not having a shoulder dystocia at the valet parking at the hospital. Not today. And he was golden. One shoulder came out, the other shoulder slipped out, and I literally gave him to you. And then you put him on your chest, and then we tied him inside the robe like a little kangaroo. Yeah. And people will ask, well, what about the cord? It was still attached. There is no rush in cutting the cord. Then we used the wheelchair. So the man showed up again, and this time he brought you the wheelchair, and he went and he got his sweater from the car, and we wrapped your baby in the sweater and then put the baby chest to chest in your robe. And then he disappeared.
Yeah, I still have the sweater.
He just disappeared. He was like a little angel that just showed up. And also there was a female valet attendant who also came to help, who later told me, I knew that baby was coming. There was just a couple people that had that intuition, but like there was no action really on the part of the valet staff. God bless them. So then nurses came down, and then what happened? So what's going through your head now? You pushed out the baby in like a push, maybe 1.5 pushes, maybe.
Yeah. So I don't know. I was just, I remember I was holding my baby in my arms, standing up, and somebody was kind of holding my back up. Maybe it was you. And they asked me something, if I wanted to sit down. And I was like, oh yeah, no, I'm good. I can stand. It just felt like I could just keep going with my day. But so they brought the wheelchair.
They do, right? They have babies and go back to doing what they're doing.
Exactly.
That's a testament to how good you felt.
I felt really good.
Yeah, and there was no blood loss. There was no blood dripping down your legs. Yeah. It was golden. It was absolutely gold. Oh, and I think your water broke with the push where his head came out. So there was actually evidence of your birth. So when I went back after the delivery, when I was going home, because I had to Uber home to get my car, they had cleaned up pretty much, but there was a big puddle where your water had broken. And I think I took a picture. Yes. I took a picture of it. And I remembered that Elton John song that says, like, you can tell everybody this is your song. So I wrote down, you can tell everybody this is your bench. And it just had like, amniotic fluid puddle stain. And there was no one sitting on it. It just looked kind of very holy. It looked very, very holy grail. But what happened to Omid?
So while this was happening, it's a little fuzzy.
Yeah.
What happened in my head. But I have a recollection of before we got to the bench to have the baby.
Yes.
I remember we were at a post or at a column, pillar.
Big columns.
And I remember seeing Omid, my husband, rushing past me.
You did?
I do. Yeah, I do remember seeing him, but I couldn't vocalize. I couldn't
I missed him altogether.
And I don't know if that was after we had, I don't know if that's after we had decided that the baby was coming then, or if I was still trying to get to L&D at that point.
See, I didn't see him at all. Okay, so he rushed by us.
He's running up to labor and delivery.
Right. Oh, and we called labor and delivery on our way.
Yes.
We were in the car and I called labor and delivery and I said, "Hi, may I speak to the charge nurse?" And I guess charge nurse was busy. Another nurse came and I said, "We are on our way. I have this year-old mother, second baby, and she's pushing." And they were like, "Well, we're very busy." And I was like, "Well, okay, you're about to get busier. Like, what are we going to do?" Right? Turns out that at the moment of your delivery, there were 2 people in a C-section and 4 people pushing. So when Omid went up, there was already a little bit of mayhem going on in L&D. So what happened?
Yeah. So he thought that we were already up there. And so he was asking, which room were we in? And they said, nobody was admitted to L&D. You must be at the wrong hospital.
Oh my God.
And so he, of course, said, well, no, I drove them here. So
they're here.
They're here. And at that point, when they still did not know that I was there at the hospital, he realized, oh, she must not have made it. So that's when he rushed down, and there we were with the baby in hand.
We were getting in the elevator.
Yeah, we were getting in the elevator.
We were getting in the elevator with you in the wheelchair. How does he feel about it all?
Great.
Was he sad?
Yeah, I think overall, he's just very happy that, everybody was healthy and everything worked out. But definitely a little sad that he missed the main event. Yes.
Yeah. So babies have plans that are beyond what our plans are. What was the process of getting into the hospital? And your doctor hadn't arrived yet. So what was the energy going on with the nurses and the delivery and the wheelchair, and how was all of that? And your placenta still attached?
Yeah. So honestly, at that point, I was just soaking up the fact that I had just had a baby, and there he was, and just holding him. And so all of that is really kind of fuzzy to me, because I was just so in love with this new human that was now part of our family.
Able to kind of tune everybody out.
Yeah.
You were able to tune everyone out. I know that at one point the nurse had concerns that the baby might not be breathing or might be grunting. And so I remember we opened your robe and then turned the baby around, and the baby was screaming and turned pink. And then everyone was like, "Okay, this baby's okay." And I was like, I knew the baby was okay because I had caught the baby, and your baby came out well flexed, looking around, crying, going from blue to pink as they do. And he was just glorious. He was like, I'm here. And then when he was on you, he was so relaxed that it could have looked like, oh, baby's not breathing, or why is the baby so quiet? Let's rush and get this baby some whatever we need to do. But he had just had a very chill, unmedicated vaginal birth on his own time. He had come out with 1.5 pushes, and he was just laying on your belly. He was so relaxed. Who snapped that picture? We have a picture of your birth, and I have no idea where it came from.
I think
was it a passerby?
Valet?
She was in the picture.
Oh.
She's in the picture. So I don't know where the picture came from.
I don't know. Yeah.
So someone must have taken the picture, then sent it to the valet, because when I went down, they were like, "We have some pictures." And I was like, "But how did that happen?" So we actually have the picture. And it was such a beautiful moment. And what I love was you got your delayed cord clamping, because you really wanted delayed cord clamping and you just weren't sure how the hospital was going to be with delayed cord clamping. The cord stayed attached until basically your doctor came, I think, or maybe 10, 15 minutes later. How did you feel when your doctor came in? What was the energy in the room?
Overall, I think the energy was... it was pretty positive.
It was positive. Yeah. It felt good.
Yeah.
It felt good. And your doctor was like, "I knew you were going to have the baby today." She was so happy and chill and fun, and came in and caught the placenta.
Yes.
And I think maybe did, checked your bottom and stuff. And that was it. And you all were like done.
Yeah.
essentially. How did it affect your mothering experience going into being a mama again, number 2?
Yeah, I think it just helped me kind of become more confident. I remember becoming a mom the first time. It was definitely a process. And it was almost like hard to believe that I was actually a mom. But this time I felt like I was able to really kind of embrace it even more. And I felt really empowered, being able to birth anywhere. Because babies come. They have, like you said, their own plans. So just felt even more empowered and just even more confident in being a mom.
How soon after the delivery did you go home?
The following day. Yeah.
So you stayed the one night.
24 hours.
So you don't have to stay 2 nights, which hospitals allow you to stay 2 nights. But a lot of people, especially if the birth was uncomplicated, the pediatrician has seen the baby and everything is good, the OB signs off, the peds sign off, you don't have to stay 2 nights. And especially people who are having their subsequent children after number 1, they want to get home to the other kids because the other kids also need the attention. How was the transition for your toddler with a new baby?
It was great. He was very excited. He's still very excited about his little brother. But he had been really looking forward to becoming a big brother. And so he just really welcomed him with open arms. And it's amazing to see now after like 4.5 months, just their relationship and how that's really blossoming and their love for each other. The little one, anytime his big brother enters the room, he just lights up, and it's just really
they really look up to them.
Really
like
beautiful.
He can do things I can't do. Let me watch. It's
Absolutely.
incredible. How was the breastfeeding journey this time?
It was a lot easier. I think just having had the experience before, but then also the second one didn't have the tongue tie. So.
Yeah. And your mood, anxiety, anything, depression, blues, did you have anything at all?
Maybe a little bit of baby blues, but it was very minimal. I felt like
moderate, and it passed quickly. Did you do anything with your placenta?
No.
Did you bring it home? No. It's at the hospital somewhere.
Yeah.
Talk to me about this video. There has to be a video of your birth. There has to be.
There might be a video of the birth.
There has to be. I'm convinced somewhere in the drive of the security people is your birth.
We were not able to get it, unfortunately. There's some different stories circulating, but at one point the hospital said that they were able to retrieve the video, but that we would need to sign some sort of like disclaimer
to allow for them to use it for.
Yes, to use it for publicity. But then later, after we left the hospital and did not sign those waivers, they said that there was a video, but they would need to edit it out to make sure that, just to protect everybody's privacy. But then later we were told that there was no actual footage of the event that they were able to capture on camera.
So interesting.
Unfortunately, we were unable to.
It's such a testament to the system that cover your ass mentality continues all the way through. Like, you've already had the baby. You had a beautiful, healthy delivery. You have a healthy baby. You did great. You are ecstatic with your experience. And the footage is still not released. It's mind-boggling to me. And it's your electronic medical record. Like, that is your birth.
Yeah.
You know? So we didn't put #hospital on it, but that's okay. I'm sure it's sitting somewhere. One day it'll
surface.
One day you'll get a package at the door. It's like, here's your birth story. We've talked to all the lawyers. They said you could have it. Here.
That would be amazing.
Take it. It is such a pleasure to have you on and to hear your birth story. And I really wanted people to hear that babies come when babies come. Did you have any feelings of embarrassment or, oh my God, this is really not what I wanted? Like, what was happening at that moment just before your underwear came down?
Well, I was surprised you were asking me whether it was okay to take my underwear off. I was like, of course.
You're like, duh. It's midwifery training.
Yeah.
I don't touch anyone's body without
consent.
I would never pull down your underwear in front of a circle of people anywhere.
Absolutely.
Or even without a circle of people anywhere, because that is I think that in itself could cause trauma, is just someone going at your underwear and pulling it down in front of people.
Yes.
So what were you thinking?
Well, in the moment I was surprised, but hindsight, I'm very grateful that you asked. But at the time it didn't matter to me. It was just wherever this baby is coming, he's coming.
Yeah. It's so magical. How's he doing?
He's great. He's really good.
And his personality?
He's fun. Yeah.
I'm sure. He came in with fun.
He loves being outside, which is not
so interesting.
Surprising.
If you were to have more kids, and I don't know what your plans are. I know what my agenda is, but I don't know what your plans are. What are you thinking?
Like in terms of where I would have?
Yeah.
I think I would do a home birth this time.
You would do a home birth.
Absolutely.
You're starting to feel more
confident.
Confident about it.
Absolutely.
I love your birth story. I love you as a couple and as a family. And you have like a way about you. You have a flow about you that is so non-rigid. And I think that non-rigidity is what often yields this kind of story, because you really weren't, even during the prenatal visit, you were like, I don't want to shoulder dystocia. How can you work with me with that, like a fear, right, of it happening again? Because it's very true. Shoulder dystocia is a very serious obstetrical complication. Now, granted, it wasn't minutes and minutes long, but still, 2 hands in your vagina rotating a baby is not something you want to have again. It can be very, very scary. But perhaps your baby knew that you needed to stand when you were having him. Maybe you were able to push more effectively in that position. Maybe you knew inherently, because if you think about it, you could have pushed in many different positions. You could have laid down on the bench. We took you to a bench. You could have laid down on the bench. You could have done all fours on the bench. You could have done semi-reclining on the bench. You decided to only use the bench for support and give birth standing, which means that your body knew that that's how your baby had to come out. So there is an inherent wisdom to unmedicated birth where women can move their bodies and allow gravity to bring their baby down and know this is what my baby needs right now. I sometimes see people doing some really interesting things when their baby is close to coming down, which is like lifting up one leg, or putting their leg up on a step, or doing a little jiggle, and I'm like, what is she doing? That's so interesting. But it's because the body knows that maybe that side needs a little bit more of an opening to allow the baby to come down, because the baby's at some sort of angle that needs more space on one side versus the other. So I think the fact that you chose to give birth standing was perhaps what allowed your birth to be easier. It was also a second baby and a smaller baby. Was he smaller than the first one?
A little bit, yeah.
A little bit smaller. You're incredible. Thank you for your time.
Thank you.
Thank you for your story, and thank you for being in my life. Thanks for listening to the Mamatoosa podcast on the Industry Plant Podcast Network. Mamatoosa is hosted by me, Atusa Benji, and produced by Josh Stretton Carlson. Chris Agnew is our audio editor, and our theme music is composed by Mary Lalazarian. If you enjoyed the podcast, please consider leaving us a review and subscribing. See you next Tuesday.